Hi, my name is Aisha Rahim. I'm a psychiatrist and the Chief Clinical Information Officer, and I'm the bridge between clinicians and the IT professionals in the Trust.
And I'm Ben Rigg, Senior Project Manager within Health Informatics, and my job is to work with clinical teams to implement IT-enabled change.
In this video, we want to tell you about how at Lancashire Care we're using technology to improve the lives of our patients and to enable staff to spend more time caring. We'll tell you about our big programme of work, what we've done so far, what's coming up in the future, and how you as clinicians can get involved.
We're really excited that the Trust has a new digital programme of work which sets out our plan for the next 5 years, and we want to show you what this means for patients and for LCFT staff. There are 3 main parts of the programme. Firstly, business as usual, which means keeping the ship afloat by ensuring our current systems are working smoothly. The second part is the new electronic patient record rollout, RIO, which will be phased in over the next 2 to 3 years to replace our current systems. The final part of our plan is digital innovation, which is the creative use of technology to deliver care which is safer and more effective. These plans are not about technology for technology's sake, but using digital improvements to drive up quality and look at improving our ways of working for everyone, patients and staff.
We're also really clear that the best way to ensure that these projects and ideas work well in practice is to get clinicians engaged and involved right from the start.
Over the last 5 years, Health Informatics have implemented various innovative solutions across the Trust, which have provided lots of clinical benefits. Here are just 3 examples of what we've done so far. 400 district nurses use mobile tablets and the district nursing app to record clinical contacts out and about across Lancashire. 50,000 clinical contacts are recorded per month on mobile devices, allowing nurses to spend more time with patients. Electronic prescribing has been rolled out to all of Lancashire Care's inpatient units, so nurses, doctors and pharmacists can access up-to-date information on individual patients' medication at any time. This has resulted in a 25% reduction in serious incidents related to unrecorded medication doses to patients, so the care we're delivering is even safer. There are no paper medication charts to go missing, and time is being saved because charts no longer have to be rewritten, so our care is also more efficient. We're proud that Lancashire Care is one of the most advanced mental health trusts in the country to embark on this work in terms of maturity and scale. And our pharmacists have been invited to address national meetings on this pioneering work. Nerve Centre is the mobile software system used on all the inpatient units that allows nurses and doctors to do clinical assessments and patient monitoring tasks, such as physical health observation recording via a handheld device. This has been rolled out to over 600 users across the Trust and has replaced many of the paper-based forms that were being used previously. Now things like blood pressure and pulse measurements can be recorded in real time, with electronic reminders to prompt staff to when the next measurements are due. The system also allows staff to see trends of these measurements over time, presented in graphical format. Last year alone, Nerve Centre provided a saving of nearly £500,000 in staff time, which was released for patient care.
But this isn't the end of the story. We're also working on more ways to use technology to improve care. RIO is our new electronic patient record, which will be rolled out over the next 2 to 3 years. However, this isn't just about replacing paper forms with an electronic system. This is about using this as an opportunity to revisit our clinical pathways and processes to ensure that we're working as efficiently as we can, whilst keeping the focus firmly on the quality of care. The other great advantage of RIO is that all clinical teams will eventually be using the same system, improving the sharing of clinical data between services and having this available in one place at the right time, releasing time to care. Another exciting project is a new development within Nerve Centre. We will be introducing electronic mental health observations for our inpatients by replacing the current paper forms with an electronic form which can be filled in on a mobile device. This will allow nurses and support workers to provide safer care, particularly as the system will send electronic reminders helping staff to keep on track. It will also save time which can be spent meaningfully engaging with service users when they need it most. Eventually, we hope to be able to use the data gathered to see trends over time, which could help determine our staffing needs at particular points. This is another great example of real innovation and how Lancashire Care is streets ahead. Finally, we've established a new digital improvements group in the Trust to allow staff who are interested in technology to come together to share projects that they have implemented or ideas that they have about the creative use of technology to deliver care, and to spread this good practice to the rest of the Trust. The group also looks further afield to see what other innovative practice we can learn from to bring into Lancashire Care.
My name's Zuba Patel, and I'm the Senior Modern Matron working within the Mental Health Network. It's absolutely vital that frontline clinicians are involved in the development of technology solutions to deliver healthcare right from the start. This ensures that we end up with the systems that work for patients and work for the staff members using them every day. For example, I chair the Nerve Centre Project Review meeting, and I've seen at first hand what a difference introducing Nerve Centre has made to improving the safety and quality of care for our inpatients. Without that clinical input, we would not have been able to achieve this. You don't need to have an IT background to contribute, you just need to be interested in driving up quality using technology and to know what does and doesn't work in your service. There are lots of ways to get involved in what we're doing in Lancashire Care around digital health. We are recruiting for 4 new Band 7 clinical facilitators who will be seconded to the Health Informatics department to assist in the rollout of the new electronic patient record, RIO. The post holders will work closely with Aisha, the Chief Clinical Information Officer, and Health Informatics team to help the clinical services have a smoother transition to the new system. We've also got the Core Clinical Forum, which is a group made up mainly of clinicians that meet every 2 weeks to advise the Health Informatics department on the development of RIO. Find out who represents your service or professional group for more information. And finally, there's the new Digital Improvements Group for clinicians who are interested in new ways of using technology to deliver care. This group meets up every quarter, and you can contact them on digital.innovations@lancashirecare.nhs.uk.
If you would like to find out more about any of the projects mentioned, or if you want to get involved, you can contact me directly by email on aisha.rahim@lancashirecare.nhs.uk.